something wasn't right. And we went to a couple of different doctors actually expressing concerns because it wasn't that one thing that just came through that said, ooh, this is it exactly. She had a skin rash, she'd be tired, she would be really stiff, she seemed to be very sore, but it was hard for her to tell us exactly what was going on. And so it's really frightening when you're in that situation. And you worry, you wonder, will they figure out what's wrong with our child? So that's a very scary situation for our whole family to be in. We were worried about Ella because she just wasn't behaving like a normal, regular, healthy, vibrant 3-year-old. And what we found is that Dr. Reinhardt is a very caring, compassionate, very, very knowledgeable physician. And what we really appreciate about his approach is that, first of all, obviously he's great with kids. And so he's really built a good trust relationship with Ella, and he's able to connect with her. But he also has that same relationship with every member of our family. And that's the thing that we really value about Children's, is that ability for this institution to just really wrap their arms around us as a family. And that's so comforting, because when you hear that you are 3 out of a million, it's really scary. So we think that the rheumatologists across the country, they are truly the unsung heroes, and Dr. Reinhardt certainly fits the bill there. And so oftentimes the diseases that are cared for by rheumatologists aren't necessarily capturing the bulk of the funds and the resources that are available in the medical community. And so we thought it was important to support the work here locally. And we are so excited that the funds for Team Ella will be attributed to the new pain clinic that will happen and will take place here at Children's Hospital. And a pain clinic is just so important in the pediatric world, because with children who are so small, like Ella, when she was 3 being diagnosed, it was really hard for her to tell us exactly where it hurts and the type of therapy that she would need to be able to help her. And so having professionals who are really helping kids who have problems with their joints and their muscles, kids who can't do those everyday things because it hurts, and having a pain clinic dedicated to those children is going to make all the difference in their life. Driving down Dodge Street countless times, driving right by the hospital, you take for granted that it's there until you need the hospital one day. And for us, Ella has been in the hospital more than 30 times since she's been diagnosed, and so we've had the opportunity to meet lots of families who are on a very similar journey and a similar path. And we've experienced firsthand the impact that this hospital has, not just with our family, but with all of the families who are treated there. And it's amazing to us, with a child with a rare disease, that we've also met other patients who also have a very, very rare disorder or disease. And Children's pretty much has a specialist for just about everyone. And that takes money, that takes resources, and that takes support. And I can tell you that as a family who has benefited greatly from the care at Children's, we can't imagine Omaha without a Children's Hospital. And every single dollar that's contributed to the hospital is well spent. These children are incredibly cared for, and they feel very special and very loved. And I think the ability for the hospital to connect with the family, that's a rare thing. And it's just such a special gem in our city. So we want to make sure that that support continues and that people continue to support the work.